We are privileged to be at the vanguard of advancing technical cooperation between countries and working in partnership with the Ministries of Health and other ministries, civil society organizations, other international agencies, universities, social security agencies, community groups, and other partners to promote and support the right of everyone to good health. The Caribbean Subregional Program Coordination Office was established in 1978 in Barbados. What the PAHO Caribbean Subregional Office does is provide technical cooperation to support the health agenda of the major intergovernmental mechanisms in the Caribbean subregion. In other words, CARICOM and its institutions, including the Caribbean Public Health Agency. This subregional approach of working with integration mechanisms is an important distinction from the role of the PAHO country offices, which work primarily with the Ministries of Health. In the region of the Americas, PAHO recognizes 4 subregions: the Caribbean, Central America, North America, and South America. The Caribbean is known for having made significant public health achievements through joint collaboration and coordination. This cooperation is important given the threats that the subregion faces. The Caribbean is comprised of small island developing states with vulnerable economies prone to hurricanes, as we are currently witnessing, and the economic turmoil that ensues. Given this scenario, PAHO has invested in a subregional approach in response to the grouping of member states to complement the national technical cooperation. The work of PAHO's subregional program focuses on producing regional public goods, or approaches that benefit all Caribbean countries without requiring significant individual and national investments. It's looking at what can be done at a sub-regional level so as to alleviate each of the countries from having to make the financial and human investments individually. This includes developing Caribbean-wide policy, norms, guidelines, or even legislation that can be adopted by each country. We provide technical support and work closely with the CARICOM governance structure that brings together heads of government, ministers of health, and other key players to develop policy and shape the health agenda. Once policy is endorsed by the subregion, our country offices support the Ministries of Health to implement. Throughout the years, there have been some important achievements that occurred in the spirit of cooperation in health. One of the hallmark achievements in the Caribbean cooperation is the Port of Spain Declaration on Non-Communicable Diseases, and we are now celebrating its 10-year anniversary. In 2007, Caribbean heads of government united on this declaration, which includes a set of time-bound goals for countries to tackle NCDs. PAHO was a key player to that movement, and we continue to work to achieve its goals. There are other examples. In the early 90s, the English-speaking Caribbean countries were among the first to eliminate the transmission of measles. 10 years later, they were able to eliminate rubella. Also in the early 90s, we saw a massive scale-up of the Caribbean response to HIV, and PAHO had an office to respond to HIV. And our most recent achievement is that the Caribbean is in the process of validating the elimination of mother-to-child transmission of HIV, bringing in a new generation of AIDS-free children. PAHO's vision is that all persons have universal access to health and universal health coverage. In order to achieve this goal, the PAHO Subregional Office embraces the spirit of Caribbean collaboration and coordination in health and the close work relationship with CARICOM to make this a reality for the Caribbean. Our country program specialists provide technical cooperation to the UK territories that are part of the OECC.
And I am based in Anguilla, and I'm responsible for Anguilla, the British Virgin Islands, and Montserrat. What my job entails is working very closely with the Ministries of Health of these 3 British overseas territories. On a daily basis, I work with the chief medical officers. What we do is to provide technical assistance through the development of project proposals, and these proposals are submitted to the Barbados office. Once these proposals are submitted to the Barbados office, a number of technical assistance activities can occur. The provision of consultants, training, but also the technical advisors working along with the countries to provide assistance in the areas of communicable diseases, non-communicable diseases, surveillance activities, and disaster management. The territories each have individual budgets, but we work collaboratively as a team. For example, if one territory decides to initiate a particular training, for example, in the area of international health regulations, in order to be able to get all 3 territories on the same path of development, those other 2 territories are invited to the training sessions in the territory which initiated. We also have a country cooperation strategy which was developed, a document which was developed 2 years ago, and it covers areas pertaining to disaster management, mental health, communicable diseases, and non-communicable diseases, which is the focus of a lot of our activities.
In the Barbados office, there's also a technical advisor who supports the French departments in the Americas.
Because the French territories are basically the same as France mainland, we don't have a Ministry of Health to say there. We don't have like a national representative, but we have local representation of the Ministry of Health. So those are the people I'm interacting with. And what we are trying to do is really to create a dialogue with non-French-speaking island. The language barrier can be an issue, and in the past we have seen that there were not enough or as many interactions as there could be. So we are trying to look at different areas of the health sector where we can develop more activities. So those activities are in the 5 big area of PAHO. So that's, for example, for communicable disease. We have been working a lot on vector-borne disease in the recent year with chikungunya and Zika. In the French department, they have like a quite interesting research institution like the Institut Pasteur. Actually, Institut Pasteur of French Guiana is a WHO collaborative center for malaria, but they are working a lot on vector-borne disease. So the idea is really to bring up the specialists from those departments with the specialists from the English-speaking Caribbean together. On non-communicable disease, we are also doing a lot of things on cancer, for example, where we have for example, a good cancer registry, and we are trying to get data from the region. What is interesting is that the people from the French Caribbean, in terms of population, look more like the population from the sister island around, like they would be Afro-descendants. And if you look at some trends, for example, for cancer, it's more interesting to compare yourself with the rest of the Caribbean, to look at local factors, and to compare yourself with France mainland. So when you want to have interesting data, it's interesting to look, to open yourself to the rest of the Caribbean than to look at what is happening in France mainland. In terms of health system, because they are French territory, they have to provide the same type of health services as the health services you would have in France mainland. So that means that you have a tertiary hospital, university hospital, who are offering some services that may not be available in the other Caribbean. For example, for cardiovascular surgery, neurosurgery, and so on. So there is also a specific interest or potential to bring those type of services to the rest of the region. Finally, in terms of IHR, that's also an activity that we work a lot on. As you know, there have been some expectation from all countries from the region to reach IHR expected core capacity, although some areas are not openly available in the region. If you look at response to chemical, nuclear, radionuclear events, we may not have experts in the region. So that's why I'm trying to bring those French experts who are there and to bring the knowledge to the other countries.
PAHO is committed to ensuring that all people, have access to the health care they need, when they need it, with high quality and without fear of falling into poverty. Through its work, PAHO promotes and supports the right of everyone to good health.